Today I want to talk about 10 keys to improving blood pressure. Elevated blood pressure is one of the most common reasons people come for evaluation in the ER. It's not uncommon for someone to take their blood pressure at home and find it to be somewhat elevated and take it over and over again out of fear, watching it go higher and higher with each subsequent check, and end up in the ER terrified that they're going to have a stroke, a heart attack, or die. There are plenty of reasons to keep your blood pressure under control, so it's important to pay attention to it, especially if you believe it's consistently staying higher than it needs to be. And here are some reasons why. Hypertension can lead to damage to the endothelial lining of arteries, leading to heart disease, kidney damage, and stroke. So I want to talk about 10 keys to improving blood pressure. Number one is simply to stay physically active. Being physically active helps metabolize excess blood glucose and in turn acts as a hedge against fat storage, which can increase blood pressure. Aim for at least 30 minutes of physical activity every day, even if that's just going for a walk, jumping rope, or swimming, but something that gets you moving every day. Number two, strive to reach and maintain your ideal weight. Excess weight can increase the strain and demand on the heart, so making it a goal to maintain your best weight is worth your time and effort. We've essentially normalized excess weight in America because, in fact, it's become the norm. More adults are either overweight or obese now than at ideal weight, but that doesn't mean that it's healthy. We should strive to reach and maintain our healthiest weight for our height. Number three is to keep your cortisol in check. Cortisol is a steroid hormone produced by your adrenal glands in times of stress, and it acts counter to insulin, causing the release of glucose from the liver into the bloodstream. This is fine if you're being chased by a dog or a tiger or threatened in some way, as there are times when we do need glucose released into the bloodstream to give us the energy and the fuel to run away or to fight or to deal with a stressful situation. But chronic stress can lead to persistently elevated cortisol levels and in turn lead to high blood pressure and excess blood glucose and insulin levels. So doing what you can to keep your daily stress levels at bay can help you reduce cortisol surges and help improve blood pressure. Number four, stay well hydrated. When we're dehydrated, sodium levels in the blood will often rise and our system responds by releasing a hormone called vasopressin, which works to help the body hang on to water. Vasopressin also can cause blood vessels to constrict, which makes blood pressure rise. So one of the best defenses against this is to keep yourself well hydrated with non-calorie containing fluids and ideally water. Number five, decrease excess blood glucose and insulin levels by reducing processed dietary carbohydrates. So many food products available to us are high in sugar and processed carbohydrate and have the potential of keeping our blood glucose and insulin levels elevated. This increases fat storage, which adds to weight gain and increases inflammation within the body, which can elevate blood pressure. So focusing on low carb, ketogenic, and even carnivore nutrition can help decrease blood glucose and insulin levels, helping to improve blood pressure. Number six, limit alcohol. Alcohol influences blood pressure through a variety of different ways. Alcohol inhibits a hormone in our bodies called antidiuretic hormone and causes us to urinate excessively and lose body water. This loss of body water can lead to a state of relative dehydration and a contraction of our arteries, resulting in an elevation of blood pressure. Alcohol also adds unnecessary calories, which can lead to weight gain from the alcohol itself. But alcohol also promotes something called disinhibition, or a lessening of self-control when it comes to indulging in foods or drinks, which also add to weight gain. Number seven is reversing fatty infiltration of the liver. Fatty liver is commonly associated with elevated blood pressure, and many people don't even realize that they have this. If you're not at your ideal weight or you've been found to have elevated liver enzymes, it's worth talking to your doctor about getting an ultrasound of your liver to rule out fatty infiltration of the liver. If you do have non-alcoholic fatty liver disease, it's important to discuss with your doctor strategies to reverse it, because doing so can help improve blood pressure. Number eight, avoid seed oils. Foods cooked or prepared using seed oils such as soybean, sunflower, corn, safflower, cottonseed, and canola are all pro-inflammatory within the human body. And anything which promotes inflammation in the body or within the vascular system increases the possibility of hypertension. So consciously avoiding seed oils and choosing alternatives such as olive oil or avocado oil are healthier choices, and both are believed to help lower blood pressure as well as reduce inflammation. Number nine, talk to your doctor about sleep apnea if you happen to snore loud enough to disturb your own sleep or the sleep of others, or if you happen to wake up gasping or choking, or if you have pauses in your breathing during sleep, or if you have excessive daytime drowsiness where you can't seem to stay awake at work, or you're too tired to drive, or even if you doze off at times while you're driving. Sleep apnea can put a strain on the heart and increase the likelihood of high blood pressure and other cardiac conditions. So see your doctor if you have any of those signs. Number 10, just check it. Get a good automated blood pressure cuff and keep an eye on what your blood pressure is doing. Take your blood pressure once in the morning and once in the afternoon at the same time. Make sure you're calm and relaxed when you take your blood pressure and record the readings for at least 3 days in a row. Then schedule an appointment with your doctor to review your home readings. In the meantime, if your blood pressure is concerning or high at any time, call your doctor and let them know the readings that you're seeing. A significantly elevated blood pressure might prompt them to encourage you to go to the ER for evaluation. Many people with high blood pressure have no symptoms whatsoever. So if blood pressure isn't checked, a problem might go undetected for years that could have been addressed much earlier. As an ER doctor, I believe you're always better off being safe than sorry. Thanks for watching. If you like this video and you want to see more like it, subscribe to the channel, and I will see you in the next video.